Hello, this is Chris Forrest from the University of Pennsylvania and the Children's Hospital of Philadelphia. I'm also a faculty member in the Health Measurement Network that's part of the National Children's Study. I'm delighted to be speaking with you about our concept of what is health. In this talk, I will be formulating the theoretical basis of health by reviewing prior conceptualizations of health as far back as Hippocrates. We'll summarize, based on these prior conceptualizations and our own theoretical views, a logic for articulating a new theory that we call health-as-livingness. This new theory enables the identification of dimensions of health that are the starting point for a new typology of health. In 2008, the National Academy of Science reviewed the National Children's Studies Research Plan. Quote, the report said, while invoking a dynamic, multifactorial life course model, the research plan does not specify any particular model or models to guide decisions on which conditions and potential causal factors are chosen for study, the timing of data collection points, the types of data to be collected, and the overall analytical report. The review also went on to say that the National Children's Study should clearly define the key constructs of child health and development and more fully develop the conceptual framework for understanding child health and development over the course of infancy, childhood, and adolescence. This review summarizes much of the motivation that drives the theoretical and typology projects for the Health Measurement Network. Our goal is to articulate a theoretical basis for health to enable and guide measurement of health and ultimately hypothesis generation. And let's begin with the prior conceptualizations of health. In 400 BC, Hippocrates noted that health results from the balance of blood, yellow bile, black bile, and phlegm, and that this balance could be altered by the environment and lifestyle. In 1865, Claude Bernard wrote about the internal milieu as a set of physiological processes that were necessary for a healthy life. Ultimately, the internal milieu became, in 20th century parlance, homeostasis. 1948, we see a transformative definition of health proposed by the World Health Organization as a complete state of physical, mental, and social well-being. René Dubos, Hans Selye, and other researchers who dealt with stress believe that the states of health and disease are the expressions of the success or failure experienced by the organism in its effort to respond adaptively to environmental change. That is to say, adaptation and the organism's fit within its environment is the essential ingredient for health. Christopher Bourse, a philosopher, wrote about species-typical functioning. In other words, health is seen when A, think of it as A as an individual, is completely healthy, if and only if A lacks all diseases, i.e. if and only if all of his or her bodily or mental functions fall within normal levels. This is a definition of health that was intended to be descriptive and value-free. It was meant to be measurable as normality for a given species. This is a concept of health that divorces the organism from its environment in terms of assessment of health. In 1986, in the Ottawa Charter for Health Promotion, health was noted to be a resource for everyday life, a positive concept emphasizing social and personal resources as well as physical capabilities. Leonard Nordenfelt, responding to a lot of philosophical discussion on Christopher Bourse's species-typical functioning theory of health, believed that biological functioning could not adequately describe health. That in fact, health is a normative concept. It inherently has a value component. He defined health as P is healthy if and only if P has the ability, given standard circumstances, to realize his or her vital goals. And Nordenfelt thought of vital goals as those goals that are minimally necessary to achieve minimal state of happiness. And lastly, Richmond in 2004 built on the holistic theory of health and also on the Ottawa Charter, noting that in his theory of health as embedded instrumentalism, health allows individuals to reach or strive for their goals, health qua organism and health qua person. In other words, biological goals and individually determined goals. That health is of instrumental value. It enables the organism to fulfill necessary biological goals, but also the individual as a moral agent to pursue. In 2004, the National Research Council and Institute of Medicine proposed a new definition in Children's Health, the Nation's Wealth, for child health, stating that children's health should be defined as the extent to which individual children or groups of children are able or enabled to develop and realize their potential. So here is a new concept, health potential, to satisfy their needs and develop the capacities that allow them to interact successfully with their biological, physical, and social environments. So concepts of adaptation, as I said, health potential, and also the development of health across the life course are now introduced in this new definition. But still, like the Ottawa definition, health is being viewed here as of instrumental value, as a set of resources that enable one to realize his or her potential. So to summarize these prior conceptualizations of health, first, there's a general trend now towards viewing health at the level of the individual, a holistic view, that you simply can't analyze the parts of a person or the parts of an organism to know whether or not he is healthy. You need to view the entirety of the individual, the ensemble, if you will. The role of the environment in various definitions of health can be completely separate from assessment of health, as in the species typical functioning definition proposed by Forrest, or it could be integral to the definition of health among theorists who say that health is adaptation to the environment. Most definitions now view health as of instrumental value, that it's a set of resources that enable goals to be pursued and achieved. What these goals are, though, vary across the different formulations. In some cases, they're biologically determined goals. In embedded instrumentalism, it's both biological goals as well as desirable goals. With the National Research Council / IOM's definition of child health as an exception, I would suggest that most, if not all, of the other definitions view health statically. They do not view health as developing over the life course, and I believe this is a missing piece of prior conceptualizations. And finally, I like to say that all of these conceptualizations are incredibly aspirational. Boy, if we could only have complete well-being across physical, mental, and social dimensions. But to be useful, a definition of health has to be operational, has to allow us to describe health in meaningful ways to guide measurement. This is an important piece of what's driving us towards creating a new theoretical formulation of health. So our challenge is to develop and formulate a theoretical model of health that specifies what health is in sufficient detail to enable a comprehensive description of health, to create a typology of health, what are all the various health assets that comprise health, and ultimately to measure health. To develop our theoretical formulation of health, we began with 3 assumptions. First, health is a property of all living beings. It's not unique to humans. It's applicable to bacteria, plants, and humans. So any theoretical model of health ought to apply across all living species. Second, health must be viewed at the level of the whole ensemble. That is to say, health is an emergent property of the whole. Third, health has instrumental value. Many theories of health view it as a set of resources that enable various goals to be achieved. In our view, health enables an organism to have a lived experience, to pursue various activities, to participate in social roles, to thrive within its environment. This, if you will, these 3 assumptions comprise the framework within which we created the theoretical model of health. We view health through the lens of a living systems theory. We note that health assets fill an entity with life. Health, in other words, is an expression of a being's livingness. Health is livingness. And it's this concept of livingness that we have to understand better in order for us to articulate what we mean by health. What is health? What isn't health? So whatever we say health is depends on how we define the essential attributes of organisms that permit them to thrive within their environment. We believe that survival and reproduction are important parts of an organism's thriving, but that a broader view of an organism needs to be taken to view health. That organisms don't just exist to survive and reproduce. There's also this concept of thriving that subsumes those two important outcomes, but also includes. In the next few slides, I'd like to articulate the specific health asset dimensions that are derived by taking this living systems view. First, living systems have a dissipative system structure. They're thermodynamically open and constantly exchanging energy and matter with the environment. It's this energy-matter exchange that enables a living system to function far from equilibrium, to self-organize internally. And derived from this dissipative system structure is the health asset dimension that we call energetics, which is the living being's management of its matter-energy flows. This would include such physiological functions like respiration, circulation, water balance, digestion, physical fit. Next, living systems are autopoietic networks. This means that a living system is able to make itself without loss of identity. Every year to two, a human being turns over nearly 100% of all its atoms. And it's these autopoietic functions that enable maintenance of identity, maintenance of all the interrelationships of the cells, of the organs that produce what you know as Joe or Jane. It's also important to note that these internal processes of autopoiesis are directed by the living system and not directed from outside of the living system. The living system has autonomy. In order to maintain identity and to facilitate autopoiesis, living systems have to have a number of mechanisms that enable adaptation. We define this very simply as the capacity to manage challenges from both the internal as well as external environment. Adaptability health assets prevent the occurrence of a stressor or challenge, but they also may be involved in buffering the effects of a challenge or a stressor. And when damage does occur, those healing functions that are necessary to repair the damage. Third, all organisms sense and perceive information. They're in constant information exchange with their environments. All living systems exchange energy, matter, and information with their environments. But it's not just a matter of exchanging information. One must also discern what it means, and formulate thoughts or actions in response. All organisms have what we would call mind, the ability to know. Even a bacterium has mind. It can sense its environment, say it's a chemical gradient, interpret what it means, and act in an appropriate way, say to move across the chemical gradient in order to seek out a resource or nutrient. And according to Maturana and Varela, it was the co-occurrence of autopoietic networks and mind that together created the essential ingredients for life. So our third health asset dimension is mind, which simply we would say is the management of information through sensing of information, perceiving what it means, cognition, and emotion. Fourth, a living system need not reproduce to be alive. However, life would cease to exist without at least some number of organisms within a species having the capacity to sustain the species over time. I like to say that if autopoiesis is self-making of a single living being, it is reproduction that is species-making for all living beings of a certain type. Reproduction is clearly a critically important health asset for a species, and we define it as the production of offspring. And finally, health is a set of resources that enable valuable acts or beings. Health, in other words, is the capacity to achieve these doings and beings. The various doings and beings that are available to an organism comprise its opportunity set. So we believe that the essential goals that an organism can pursue as a result of its healthfulness are a set of opportunities from which it selects various activities or participation in social roles. The health asset dimension here is what we would call capabilities, borrowing a word from Amartya Sen. Defined as the capacity to do or know something. It's not the actual doing or the knowing, it's the ability to do or know. There's a choice that will be involved in which doings and knowings an organism pursues. There's also an effect of the environment on what opportunities may be selected. But in order to expand that opportunity set, there needs to be various capacities to move through the environment, to care for oneself, to communicate with others. In summary, there are 5 health asset dimensions that are derived from our initial 3 assumptions and our global view of health as livingness. These dimensions include energetics, the management of matter-energy flows; adaptability, the management of challenges that are presented to an organism both from its internal milieu as well as externally; mind, the management of information; reproduction, the creation of offspring; and capabilities, the capacity to execute tasks and participate in social interactions. In our background paper, What is Health?, we elaborate on each of these 5 health asset dimensions in much. To flesh out our theoretical model a bit further, I'd like to share with you our initial thinking on the production of health as well as what health enables. So both its influences and its consequences. Health has 5 asset dimensions. And to review, they include energetics, adaptability, mind, capabilities, and reproduction. It's these asset dimensions and their subdimensions and domains that will comprise the comprehensive description of health and what we will call a typology of health. Health assets are influenced by both intrinsic and extrinsic factors. Intrinsic factors include subcellular variables such as the genomics, epigenetics, and proteomics, factors at the cellular level, tissue levels, the biochemical milieu, and the microbiome. These factors are biological in nature, and their intrinsic influences in that if we view health at the level of the whole ensemble, these are subsystem factors that can influence the health of the organism, health as an emergent property of an organism. Health also has extrinsic factors. It's influenced by the natural environment, food, the built environment, the network of social relationships, societal influences such as economics, crime, etc., and the intrauterine environment for a fetus and a mother. Health, along with other factors, influence and expand a living being's opportunity set. That is, health is of instrumental value for expanding the various activities that a person could do or roles a person could participate in. That's an organism or a human's opportunity set. Health is not the only influence on the opportunity set. The historical epoch that a person finds herself in is an important influence, as is culture, level of technological development, and wealth. An individual chooses to pursue specific opportunities. There's a broad set of opportunities that an individual could choose from, but it's this process of choice that determines in part, what an individual's lived experience will look like. In order to go from an opportunity set to lived experience, there's also another factor that's important. That's motivation or grit. So if you choose to do something, you need to be motivated to strive to reach your goals. The lived experience includes the actual activities or the actual social roles that a person experiences. It could be being a good student, being a parent, going to college, playing chess, but it's also the well-being that results from accomplishing your goals, having a sense of meaning and purpose in life, and a sense of self-acceptance. So this is the very basic model of health that we hope the health-as-livingness theoretical construct will enable the elaboration of. We want to summarize by saying that our view of health-as-livingness starts with the notion of health as imbuing an entity with life. Health is livingness. Health assets are derived from the essential characteristics of living systems. Here we're showing the essential characteristics of living systems on the left and the health asset dimensions that are derived from those living system characteristics. Health assets are of instrumental value. They enable an organism's lived experience. Now, if we agree that these 5 dimensions of health assets are the starting point for describing health, ultimately we can elaborate the specific component concepts and ultimately the specific domains that are measurable and discrete, creating ultimately a theoretical description of health that's translated from the theory into practical discrete categories. This is the health typology. When the typology, this listing of specific health assets, which may number anywhere between 100 to 300 or more health assets, we will have formed, if they're hierarchically arranged, a taxonomy of health. And when the health typology is finalized, it will enable the description comprehensively of health and will guide measurement. A final note is that disease is an entity that's related to health but different from health. It's professionally defined. Disease is a useful construct for health care, but may not be a useful construct for describing health. We believe that health assets enable living beings to do things. It expands an opportunity set, whereas disease has negative influences on an opportunity set. A disease is a challenge, if you will. Health typology will provide a standardized language for describing the impact of disease on an individual's health. So you may have one disease creating an impact on 20, 30, or 40 different health assets. But as we begin to use this health asset language to describe the impact of disease, we'll start to have a comprehensive description of the connections between disease and health. Thanks for listening to this presentation, and we look forward to having further dialogue with all of you on what it means to be healthy.